Hi, welcome to the latest medical educational video by Dr. Wellness. My name is Dr. Chen Yiming and today we'll be talking about diabetes. So before we begin, please click the subscribe and notification button so that you'll be updated whenever we produce a new video. What is diabetes? What are the symptoms of diabetes and how do we diagnose it? Are you aware that it is a serious condition that can result in multiple organ damage within our body? So what are the treatment options? Is it only through medications? To all this and more, please continue to watch till the end of the video to get a full picture about diabetes. Diabetes is actually a metabolic condition whereby the regulatory mechanism within our body for sugar is faulty. That results in an overly high levels of sugar circulating within our bloodstream. There are mainly two types of diabetes, type 1 and type 2 diabetes. Today, we'll be focusing on type 2 diabetes. In a normal healthy individual, insulin is released from the pancreas after our meal. The insulin will help to convert the sugar molecules from the meal into a storable form of carbohydrate which is then stored within our muscle cells and our liver cells. If you have diabetes, the insulin is either ineffective or insufficient. As a result, there will be an excess of sugar molecules present in the bloodstream due to the failure of storage. Diabetes can be symptomatic or asymptomatic. Most of the time, they produce symptoms when the sugar levels are high. The symptoms are increased thirst, increased urination, increased weakness and fatigue, unexplained rapid weight loss, blurring of vision, frequent infections. For the asymptomatic cases, these cases are often diagnosed during a health screening. So it is still highly encouraged for patients above the age of 40 years old to go for your annual health screen. Speak to your friendly doctor for more information. If you are experiencing the above symptoms that I'm talking about, please go and see your doctor to conduct a glucose test check to see if you're actually diabetic. Some of the technical numbers that you may be interested in. In a diagnosis of diabetes, if you have no symptoms, you require 2 separate blood tests on separate occasions showing a fasting venous glucose of more than 7, oral glucose tolerance test of more than 11.1, or random glucose of more than 11.1. If you are symptomatic, you just need 1 test. Diabetes is a serious condition. If you leave it untreated long enough, it will invariably result in damages to multiple organs in your body. It can affect your vision due to cataract, due to retinal damage. It can affect your heart due to damage to the heart muscle walls, due to damage to the heart arteries. It can damage your kidneys, resulting in long-term kidney failure and dependent on renal dialysis. It can affect your nerves, resulting in numbness and tingling sensations of your legs and hands. It can cause serious obstructions to your arteries, causing stroke. Now, after discussing so much, we'll be coming to the treatment of diabetes. Treatment of diabetes is an extensive discussion. I will summarize and focus it into a few salient points so that you can take it back and digest. 1. Diet. 2. Exercise. 3. Weight loss. 4. Medications. It has to be a combination of the 4 components. The first thing to take note of is your diet. Reduce the sugar level in your food. Cut down the sugar that you put in your coffee, tea. Avoid sugar flavored drinks, avoid colored drinks. Always go for your plain water if possible. Reduce the snacks and things like your cakes, cookies, ice cream because they're very high in sugar levels. Reduce the portion of each meal. It is very tiring to count calories. So to begin with, a simple method is to reduce by 20 to 30% of your every meal, and that alone has reduced the calorie intake. Number 3, go for high fiber such as your fruits and vegetables and increase the protein intake by eating more fish and chicken or other forms of meat. Exercising. Exercising is really important to us, right? What it does is that it actually helps to enhance the efficiency of the insulin. It directly burns fat, it brings down the sugar level, and it actually lowers our blood pressure. So exercise has many positive benefits on our health. It can treat hypertension, cholesterol, and diabetes. How much to do? Health Promotion Board Singapore recommends 150 minutes of exercise a week, and you try to incorporate a variety of exercise such as cardio activities like running, cycling, and also resistance training like weights and body weight exercises. Weight reduction. It's actually been estimated that obesity is one of the direct causes of diabetes. In fact, by being obese, you're increasing your risk of diabetes by up to 80%. So if your BMI is in the unhealthy range, please try your best to motivate yourself to lose weight. By losing weight, you are treating diabetes. Lastly, medications. I think medications are important in terms of diabetes, but lifestyle should also go hand in hand. There are many classes of diabetic medications that can be used to treat. Please consult your doctor or your family physician for more information with regards to that. So we have come to the end of the video on diabetes. Thanks for watching. I hope it was educational and enjoyable. Stay tuned for our next episode of Medical Educational Video. Till then, stay safe, take care. Oh yes, please don't forget to click on the subscribe and notification button to receive update whenever we produce a new video. Thanks again. Bye.